Intellectual disability is the most common developmental disability. Earlier, this was referred as mental retardation, but this was stigmatizing the people who are experiencing this disability. So it was changed into intellectual disability in 2013, and it was adopted by the Diagnostic and Statistical Manual of disorders, mental disorders, that is DSM-5, and also in International Classification of Diseases, that is ICD-11. And it is widely now termed as intellectual disability, and people who are experiencing it is called people with intellectual disability. So, if you want to know more about intellectual disability and understanding this intellectual disability, then this is the right place. Because today I'm going to talk all about intellectual disability. Hi, I'm Anuradha Deshpande, mother of a young man experiencing intellectual disability. I am also a clinical psychologist, counselor, and a special educator, and now a digital disability life skill coach. I'm also founder of Care and Care Life Skill Academy, and I'm on a mission to empower 100,000 parents of children experiencing special needs to build skills in them and enable them to lead a life of independence and dignity. And through my channel Dignity in Disability, I bring to you 2 weekly episodes of Tuesday Facts and Friday Facts. And in today's Friday Facts, I'm going to talk about understanding intellectual disability. So, without any further ado, let us go and look at our presentation and know more about intellectual disability. So, what is intellectual disability? Intellectual disability is a condition which is characterized by significant limitations or impairment in intellectual functioning and also in adaptive behaviors, which is originated before the age of 22. Intellectual disability is mostly diagnosed before the age of 22, and when it is diagnosed, then you can understand that the person's intellectual function and their adaptive behavior in the day-to-day functioning is significantly impaired and disaffected. And when we say intellectual function, it may refer to critical thinking or reasoning or problem solving thing, or even thinking in abstract terms. And adaptive behavior, or whatever we do in day-to-day functioning, and we will know more about the level of functioning in our further slides. The researchers working in this field opine that 1 to 3% of the world population are affected by this intellectual disability, and out of these, 85% of the population fall under the mild category. It gives us a hope that these children and individuals can be trained, educated, and to work to their optimum level of functioning so that they can lead a life of independence. The American Psychiatric Association puts the figure of 6 people per 1,000 people are identified to have intellectual disability. So let us look into the risk factors that are related to the causes, and the causes of intellectual disability can include infections. These infections of any kind, which are present at the birth or before occurring during the birth, can cause this intellectual disability. Or chromosomal abnormalities such as Down syndrome, Fragile X syndrome can cause also intellectual disability. Environmental factors like pollution or toxins in the air, lead toxin, this can also cause intellectual disability. Metabolics such as very high bilirubin in the level in babies can cause intellectual disability. Nutritional malnutrition can also lead to intellectual disability. Toxic, that is substance usage during pregnancy or before pregnancy can also lead to intellectual disability, and also children falling prey to substance abuse can also get into intellectual disability. Trauma to the mother or to the child before or after birth can also cause intellectual disability. And there are some unexplained for which doctors cannot very specifically pinpoint certain causes. They can also get into intellectual disability. So there are 4 levels of intellectual disability, that is mild, moderate, severe and profound. And how are these determined? This is while IQ tests are most prevalent one, and even now it is the relevant and important way of finding out intellectual disability. The new DSM-5 adds one more layer of diagnostic criteria, that is, apart from this IQ test, we have to work across 3 skill areas, that is conceptual, social and practical life skills. So the assessment has to be made on these 3 areas also: conceptual, social and practical life skill. So to be diagnosed with ID, your child must have below average intellectual and adaptive skills. Your child's doctor will perform 3-part evaluation for that, that is interview with you, observation of your child and standard tests. So what are some of the common symptoms that you find in intellectual disability? The main one is learning and developing more slowly than other children of the same age. Then rolling over, sitting up, crawling and walking, such milestones are also delayed and they are not according to age appropriate development. Then difficulty communicating or socializing with others. Many of these children, they have problems with communication, so they find it difficult to socialize. Lower than average scores in IQ test, that is, usually it is said that below the IQ of 70, then they are termed to be intellectually disabled. Difficulties talking or talking very late. Speech comes, they are delayed. And then having problems remembering things. Memory can also be a problem. Inability to connect actions with consequences. So they have to be really directed how their actions has certain consequences. So they have to be taught that. It doesn't come naturally to them. Difficulty with problem solving or logical thinking. That is a higher level of intellectual functioning. So these children find it difficult to go there. Trouble learning in school. In the regular setup, they find it very difficult to learn and study and learn. Inability to do everyday tasks like getting dressed or using the restroom without help. According to the level of their disability, they will find difficulty varying from even brushing their teeth to managing themselves reasonably well. But they might need help in day-to-day function. So if your child has ID, they may experience some of these behavior issues also. They will be very aggression dependency. They have to really act out to get your attention. They will do that, or withdraw from social activities. They will simply don't want to participate in any of these activities. Attention seeking behavior. They are unable to seek attention in a proper way, so they indulge in behaviors which will bring other people's attention. Depression during adolescent and teen years, because they cannot do a lot of activities like their peers. They often get into a depression and they are not able to express what they want and they are not able to manage their puberty well, so they get into depression. And lack of impulse control, they sometimes act very impulsively. Tendency towards self-injury, some children go there. And then stubbornness, Most of these people are found to be very stubborn. They have very poor self-esteem and low tolerance for frustration. They easily get frustrated, and some of them can experience some psychotic disorders and difficulty in paying attention. So the main goal of treatment is to help the child to achieve their full potential. Whatever they can do, they have to do to their maximum levels, should be our aim as parents and educators. So to achieve full potential, we can seek the help of special education, through which we can teach them reading, writing, calculation, money skills, and shopping skills, and various skills you can teach them. It is necessary to teach them social skills, to know about the social norms, conventions, and how to make friends and how to interact with others are some of the social skills we can teach them. Life skills. Life skills are absolutely important. The reason for that is these children, as we have noted, can be trainable, and if we can train them all the life skills, then their chances of depending upon others is very minimal. And if they are reasonably independent or less dependent on others, they can lead a much more fruitful life. So life skills of all sort can be taught to them. That is the reason I have adopted life skills as my main target of skills to be taught to these children, so that they need not depend on others, or at least be less dependent. Treatment may include behavior therapy to minimize some of their behaviors and modify them. Occupational therapy to weed out some of the physical problems, and counseling at various stage can help them to come out of depression or not going in there. Medication in some cases. Some of these children can also experience some comorbid conditions, and that can be treated through medications. So ideally how you can go is with early intervention. Infants and toddlers should be given early intervention, so it is very easy for them to pick up and go ahead. Special education, then family support, respect, care. Sometimes the family is too much burdened with taking care of children, and so respite, home, and other support should be given to the family. Transition services from childhood to adulthood is, it's very very important, because transition is difficult even for neurotypical teenagers. So for children with intellectual disability, they need sufficient support and education to transit from childhood to adulthood. And occasional programs have to be given, day programs for adults where they can be taught many skills. Then housing and residential options and case management, where individually you can manage a certain person, whereas they can perform other tasks independently, and for only certain tasks, wherever they need help and management, you can give that support to them. So tips for the parents: ask for help, learn about your child's disability, connect with other parents of children with disabilities, be patient. Learning may come slower for your child. Encourage independence and responsibility. Educate yourself on the educational services your child deserves. Learn the laws and which are there, so that you can help your child live their best life. Look for opportunities in your community for social, recreational, and other sports activities. So, as we said earlier, 85% of the people diagnosed for intellectual disability are from a mild category. So the prognosis is very good for these children to lead a nice life, provided as parents and educators, we are prepared to teach them the way they learn. And as parents, not only we have to introduce them to all early intervention, but you can also learn all these skills, and you can supplement to a greater extent with professional therapies available to you. So that is the reason I have come out with a life skill curriculum for parents, especially, so that they can teach their children effectively and make them independent and lead a life of dignity. So, if you want to know more about intellectual disability or any other disability, and if you want to learn how to build skills in your children, please subscribe to my channel, and also ring the bell icon. You will get notification. Please join my exclusive Facebook community called Dignity in Disability, where I bring out a lot more information, and that is the place from where you can take off your journey in making your child independent and lead a dignified life. So that's all from this video. Go and like, share, and comment in the comment box, and please spread the word about this channel so that more parents can benefit out of it. That's all from Friday Facts today. I'll see you on Tuesday Facts with skill building edition. See you there.